How does government plan to prevent further spread of the highly contagious Delta variant? To talk more about this, joining us is Health Undersecretary Maria Rosario Vergeire. Good evening, Usec Vergeire.
Magandang gabi po, sir. Good evening to all of you.
Ma'am, first of all, let's try to understand the numbers because just yesterday we were speaking with you on the chiefs. Yesterday the numbers stood at 19. Now nadagdagan ng 16. People will look at that and they will assume that from 19 to 16 in a span of one day. But what is there to first understand and to explain with regards to these numbers? Are these delayed numbers, or does it necessarily suggest anything about the speed of the spread?
When we do whole genome sequencing, we have to understand that we are getting our samples from the different regions. And the regions will be the ones identifying among their samples of positive cases, which would be sent to the Philippine Genome Center. Aside from that, the Philippine Genome Center has to do quality check when the samples arrive and will only identify those to be sequenced where the CT values are low enough so that we can get the results that we are looking for. So these samples that were tested and these 16 individuals, it varied. There were those who had been here already last April 26, and there were those who were recent. From June 23 to 28 for the Northern Mindanao. So these 16 cases are all from different timelines. But one thing that would be certain would be we were able to detect this through our whole genome sequencing, and all of them have recovered and have undertaken the necessary quarantine or isolation periods for 14 days, and they are now being strictly monitored by our local governments.
Okay, and then in the meantime, another thing po to try to understand, you are saying that this was locally acquired, not necessarily examples of community transmission. What's the difference po?
When we talk about local transmission, we're talking about a person who was infected by another person in their community, and that has to have evidence. When you talk about community transmission, you cannot trace anymore where that specific individual got the infection, meaning it has spread already in the community. So right now, we have identified individuals who are positive with this Delta variant, and they are all in different places of the country. There is just one cluster in Northern Mindanao, but they are still not in the same location. So we need to be able to identify and determine what was the origin of all of these cases. Second, we need to identify are there any links between and among all of these cases so that we can determine what level of transmission we have in the country. For now, we are saying we have local cases, but we are yet to determine if we already have local transmission.
Okay, maraming salamat po, Health Undersecretary Maria Rosario Vergeire.